Hi, today I'm going to be doing an abdominal assessment on my patient. She's over 60, so there's other things you want to consider. You want to assess her salivation and taste. These decrease, as does esophageal emptying and gastric acid secretion. You want to look for pernicious anemia, which would look for deficiencies in B12, iron, and then calcium. Gallstones also increase in these patients, as does constipation. Liver function is still there, but it takes longer to metabolize drugs. This population takes a lot of medication, so you want to look for that as well. Hi, how are you?
Fine.
Great. How's your appetite?
Good.
Good. No difficulty swallowing?
No.
Okay. You eat all types of foods, no limitations, no allergies?
No allergies.
Okay. Any antacids that you take on a daily basis?
No.
Okay. Abdominal pain you've been experiencing?
Up in this area.
Okay. What does it feel like?
It's burning.
Burning. Nausea or vomiting?
No.
Okay. And how are your bowel habits? Are you able to go regularly to the bathroom?
Yes.
Okay. No constipation or diarrhea?
No.
Any past history I should know about regarding your abdomen?
No.
Okay. Any medications you take?
No.
And you have good access to food? You're able to drive to the grocery store? You're able to have the equipment at home to make food?
Yes.
Okay, perfect. So at this time, you want to do like a nutritional assessment in the last 24 hours to give you an idea of what she's been eating might be contributing to her pain. She's admitted to having a lot of Italian food recently, not just in the last 24 hours, but all week. Okay, so why don't you lay down for me? We're going to do the assessment, okay? So the patient's undressed and the abdomen is exposed. So first we're going to inspect. We're looking at the contour, shape, symmetry, etc. Jaundice might indicate a liver problem. Striae might indicate obesity, so we're looking for symmetry, looking for any bulging, might indicate a hernia or an enlarged organ, looking for, at the umbilicus, if it's inverted, might indicate ascites, looking for any movement. Peristalsis might be normal in a thin person, but with a distended abdomen, if it's really noticeable, it can indicate an intestinal obstruction. And then we're looking for any pulsations of the aorta that could mean an aneurysm or at the very least hypertension. And then we're looking at the face and the different demeanor and the body language to assess if there's any pain, holding the knees up, grimacing, guarding, anything like that. So now we're going to begin with listening to your abdomen, okay? We'll begin auscultating, starting in the right lower quadrant. We listen to all four areas. We're listening for bowel sounds. Hyperactive sounds might increase motility, common with diarrhea, whereas absent bowel sounds might be a problem. You have to listen to a full 5 minutes to determine that. Now we're going to listen over to vascular sounds. So over the aorta, over the renal, over the iliac, and over the femoral. And you don't want to hear any bruits, which is a kind of a blowing sound. You don't want to hear any venous hum, which would be around the umbilicus, both abnormal. And you want to listen for peritoneal friction rub, which would you hear over the liver and over the spleen, where those large organs would come in contact with the peritoneal, also abnormal. So now we're going to move on to percussion. Most of it that you would hear is tympany because the intestines are hollow, but you would hear dullness over the appropriate organs. You can do it over where the liver is to kind of assess how large it is. You would go down till you hear the dullness, mark it, continue over the dullness till you hear tympany again, and then you can measure it's about 7 centimeters. The same is done where the spleen is. Okay, and this can give us an idea into enlargement. Okay, if you sit up for me for a second, we're just going to assess her kidneys. This is called looking for costovertebral angle tenderness, and it's basically over the flank area. You want to see, do you feel any pain?
No.
Okay, good. You can lay back down for me. Now we're going to palpate. You do light circular motions, and that's about 1 inch in all 4 quadrants. And then you're going to do a little bit further down, which would be more of a deeper touch, looking for sort of enlarged organs or any masses over the bladder, a full bladder, you would feel right away. Then you're going to palpate the liver. You can take a deep breath for me. Okay. And the spleen. Take a deep breath for me. And you can even do the kidney. And that would be, you ask them to take a deep breath because at that point, a portion of the organ might slide out into your hands. So.
I do have pain here.
Okay, when you're laying down? Okay, so pain laying down, pain after eating, especially acidic foods and such. This could be an acid reflux situation, especially eating a lot of tomato sauce, larger portions. When you get older, the sphincters don't work as well. So you might be feeling the acid coming into the esophagus. So talking about a better diet, the appropriate diet, and anti-acid therapy. might be a good option for this patient. Thank you.